type of sternoclavicular and acromioclavicular joints, to enumerate the articulating surfaces and the ligaments attached to these joints, and to discuss the movements related to these joints. Talking about the sternoclavicular joint, it is a synovial joint, which is a compound type of a joint. The three elements mainly take part in the formation of the sternoclavicular joint. The first one is the medial end of the clavicular. Then there is a clavicular notch of the mandible sterni and the upper surface of the first costal cartilage. You can see this is the sternoclavicular joint, where there can be seen the medial end of the clavicle, which is the first element taking part in it. Then you can see the clavicular notch of the mandible sterni, which is also helping in the formation of the sternoclavicular joint, and the first costal cartilage, and that is also helping in the formation of the sternoclavicular joint. Now, if you look at the type, this is a saddle type of a joint, the only bony joint which is present in between the axial skeleton and the upper limb. The clavicle sits in a saddle socket formed by a superior lateral manubrium and first costal cartilage. Now, if you see over here, this is more clear, the sternoclavicular joint, where you can see that this is formed by the medial end of the clavicular with the clavicular notch of the mandible sterni and the upper costal surface of the first costal cartilage. Now, when we talk about this sternoclavicular joint, you can see there are different ligaments which are actually bearing the connection with the sternum and the clavicle, and thus helping in the formation of the sternoclavicular joint. Now, in this joint, since this is a synovial type of a joint, it is also subdivided into two compartments, and that is why we call it as a compound type of a joint. And you can see that these are the two compartments which are divided by the presence of an interarticular disc. And we label these compartments as the medial and lateral compartment, which are divided or which are formed by the interarticular disc. Now, the articular surface of the clavicle is covered by a fibrocartilage. The surface is convex from above downwards and slightly concave from front to back. The sternal surface is smaller than the clavicular surface. It has a reciprocal convexity and the concavity. Now, when we talk about the ligaments of the sternoclavicular joint, we have the capsular ligament, which is also known as the fibrous capsule. Now, this surrounds the entire joint, which is reinforced by the ligaments. Laterally, or the fibrous capsule is attached laterally to the margins of the clavicular articular surface. Medially, it is attached to the margins of the articular area on the sternum and the first costal cartilage. If you look at this fibrous capsule, this is shrunk anteriorly and posteriorly, where it constitutes the interior and posterior sternoclavicular ligaments. Now, if you see, this is actually the articular disc, which is dividing into the two compartments and covered by a capsule, and this is actually reinforced on the interior and the posterior side by the interior and the posterior ligaments, which are known as the interior and posterior ligaments of the sternoclavicular joint. Then we talk about the articular disc. Now, this is the articular disc, which is the main bond of the union at this joint, or of this joint, is the articular disc. Now, if you look at this disc, this is attached laterally to the clavicle on the rough area above and posterior to the articular area for the sternum. Inferiorly, this disc is attached to the sternum and the first costal cartilage at their junction. Anteriorly and posteriorly, the disc fuses with the capsule, and the function is to absorb shocks and prevents the medial displacement of the clavicle. When we talk about the ligaments of the sternoclavicular joint, we have seen that it has the interior and the posterior sternoclavicular ligament. Then there is a ligament which is called as the interclavicular ligament, and there is another ligament which is in between the costal cartilage and the clavicle, which we call it as the Costoclavicular ligament. So these are the three main ligaments of the sternoclavicular. Coming to the interclavicular ligament, now the name indicates that this is going to lie in between the two clavicles, and this passes between the sternal end of the right and the left clavicle. Some of its fibers are attached to the upper border of the mammibrum sterni. When we talk about the costoclavicular ligament, this is attached above to the rough area on the inferior aspect of the medial end of the clavicle. Now this consists of the two lamina, and we call them as the interior lamina and the posterior lamina. The function of the costoclavicular ligament is to limit elevation of the clavicle at medial end. When we talk about the anterior and the posterior sternoclavicular ligaments. Now basically, if you remember, these are simply the thickenings of the fibrous capsule present at the interior and the posterior. Now the blood supply of the sternoclavicular joint is the branches of the internal thoracic and the suprascapular artery, and the nerve supply is the medial suprascapular nerve. So now when we come to the summary of the sternoclavicular joint, we have discussed the articular surfaces which are formed by the sternal end of the clavicle, the clavicular notch of the mammibrum sterni, and the first costal cartilage. Then there were three ligaments which we have discussed, that is the costoclavicular ligament, the interclavicular ligament, and the interior and the posterior sternoclavicular ligament. The blood supply is from the suprascapular and the internal thoracic artery, and the nerve supply is from the medial suprascapular nerve and to nerve to subclavius. We have also discussed that it is divided by the articular disc into the two cavities, and that is why it is a compound type of a joint. Now, if you look at the movements which are possible at the sternoclavicular joint, these are the clavicular elevation and the depression which is possible. Then there is clavicular protraction and the retraction which is also possible at the sternoclavicular joint. This is actually the backward and the forward rotation of the clavicle which is occurring at the sternoclavicular joint. Now, if you see, these are the different bones which are present in the body. We know that there is a clavicle, and then there is another bone which is present on the posterior aspect of the body, which is called as the scapula. Now, when we talk about the scapula has the different parts, and one of these parts, we call it as the processes of the scapula. Now, the scapula comprises of the different processes in which we take it as the three processes. One, we call it as the coracoid process. The other, we call it as the spinous process. And the spinous process goes and elaborates into a quadrangular shape, which we call it as the acromion process of the scapula. Now, when we talk about this acromion process articulates with the lateral end of the clavicle, forming another joint, which is called as the acromioclavicular joint. And this is also a synovial type of a joint, which is formed by the acromial process and the lateral end of the clavicle. So now, when we talk about the type of this joint, this will be a plane or the sliding type of a synovial joint, and the articulation will be formed by the different bones, and these bones which are involved in the articulating area will be the acromion end of the scapula and the distal end of the clavicle. The movements will only be simple because this is a plain type of a joint. So only the gliding movements, that is the anterior and the posterior gliding movements, the superior and inferior tilt and the rotation will be possible at the acromioclavicular joint. Now, when we talk about this acromioclavicular joint, we have seen that this is a plain type. It articulates between the acromion process of the scapula and the clavicle, and this is also going to have an articular disc. Now, this joint, if you see here, this is simply in between the lateral end of the clavicle and the median margin of the acromion process of the scapula. Now, there is also a fibrocartilage which is going to cover the articulating surface of the joint. Now, this is also going to bear a cavity, the synovial cavity, which is subdivided by an articular cartilage which have the perforations in it. Now, if you look at this acromioclavicular joint, this joint is also held together by a capsule, the joint capsule or the fibrous capsule, and there is an articular disc. But in this joint, acromioclavicular joint, the main bond of articulation is not the articular disc. The main bond between the scapula and the clavicle is a ligament which we call it as the coracoclavicular ligament. So if we recall the first joint which we discussed, that is the sternoclavicular joint, in that the articular disc was the main bond of union, but in the acromioclavicular joint there is a coracoclavicular ligament which is the main bond of union. Now, coming to the ligaments of the acromioclavicular joint, the first thing which we have seen, that is the fibrous capsule. We have seen that it is going to surround the joint as the joint capsule, and it is also reinforced by the ligaments which we call it as the acromioclavicular ligament plus a muscle that we call it as the trapezius muscle. Then we talk about the acromioclavicular ligament which is reinforcing the fibrous joint. This forms the superior lateral end of the clavicle to superior surface of acromion. The third one, that is the main bond of union, that is the coracoclavicular ligament. This lies extrinsic to the capsule and it reinforces the lateral clavicle to choroid process of the scapula. Now, this coracoclavicular ligament comprises of two parts. One we call it as the conoid part and the other we call it as the trapezoid part. The acromioclavicular joint, if we see, we have seen that it is surrounded by a V capsule, that is the fibrous capsule, and this was also reinforced by the ligaments which we call it as the superior and the inferior acromioclavicular ligaments. Further strengthening will be occurring by a ligament, that is the coracoclavicular ligament, which is formed by the strong fiber bundles, the lateral trapezoid and the medial conoid ligaments. If you look over here, these are the coracoclavicular ligament with two parts, that is the lateral trapezoid and the medial conoid part of the coracoclavicular ligament. This is more clear. Then we talk about the different parts of the coracoclavicular ligament. The conoid part is attached below to the root of the coracoid process, lateral to the suprascapular notch, which is, and if you see above, it is attached above to the inferior surface of the clavicle on the conoid tubercle. If you look at the trapezoid part, now this trapezoid part is actually attached below to the upper surface of the coracoid process and above to the trapezoid line on the inferior surface of the lateral part of the clavicle. If you look at the nerve supply, the branches of the axillary, lateral pectoral and the suprascapular nerve supplies this joint, that is the acromioclavicular joint, and the blood supply is from the branches of the suprascapular and thoracoacromial arteries. If you look at the movements of the acromioclavicular, it is responsible for the elevation of the scapula. The clavicle moves round an anterior-posterior axis formed by the costoclavicular ligament. It is also helping in the depression of the scapula through gravity, the protraction of the scapula as in pushing and punching movements by the forward movement of the lateral end of the clavicle and the backward movement of the medial end of the clavicle. Then there is a retraction of the scapula, which is helped by the rhomboids and the trapezius fibers, which is the backward movement of the lateral end and the forward movement of the medial end of the clavicle. Now coming to the injuries, you can see that there is a break in the ligament and we call it as the acromioclavicular separation which occurs, and over here you can see there is a dislocation which occurs in a joint, and this is the sternoclavicular joint dislocation which is occurred due to the break in the ligament. Now, if you see the injury to the acromioclavicular joint, now this occurs usually due to a fall on the tip of the shoulder, depressing the acromion process. Now, they can be in the different intensity and we classify according to the grades. Now, in the first grade, the acromioclavicular ligament is stretched but not torn, and and the coracoclavicular ligament, if you see, it is intact. In the grade 2 type of an injury, the acromioclavicular ligament, it gets ruptured and the joints get separated, but the coracoclavicular ligament is intact. In the grade 3, which is the severe type of an injury, you can see that both the ligaments, that is the acromioclavicular and the coracoclavicular ligament, they are ruptured with the separation of the joint. And when we repair it, we actually repair the grade 3 injury with a non-absorbable tape or the screw which is present and going to repair the injury of a joint. Now this you can see that this is the dislocation and there is an injury in both the ligaments leading to the separation of the dislocation of the joint in the third grade intensity, and definitely there may be a swelling or the pain which you can feel at the point. So now when we come to the summary of this acromioclavicular joint, we have seen that this is an articulating between an acromion process and the lateral end of the clavicle, and this joint is a synovial type of a joint where plane gliding type of movements are possible. This joint is surrounded by a capsule which is known as the fibrous capsule, which is surrounded to the margin or which is attached to the margins of the articular surfaces. There are different ligaments which are attached, like the superior and the inferior acromioclavicular ligament. There are accessory ligaments, which is the coracoclavicular ligament, and this coracoclavicular ligament is the main bond of union between the acromioclavicular joint. There is an articular disc which is present, which is a flat fibrocartilage disc which projects into the cavity from above. There is a membrane, the synovial membrane, which is lining the capsule and is attached to the cartilage covering the articular surfaces. Then there is a nerve supply, the suprascapular nerve, the movements where the gliding movements take place when the scapula rotates or when the clavicle is elevated or depressed. And if we go to the important relations of the acromioclavicular joint, we know that anteriorly the deltoid muscle is present, posteriorly the trapezius muscle is present, and superiorly the skin. Thank you.